This conference will now be recorded.
Okay, good morning. Any of you have been on this before, have seen this continuing education credit slide. Basically addresses what you need to do if you would like credit for today's hour presentation. That credit is good for both Kern Regional Center and for community care licensing if you happen to be a licensed facility. You must attend the entire community of practice. You must identify yourself at the beginning, either put your name on the as the participant or let Irene know via the chat who you are so that we know that and make sure that we can give you credit for today's presentation. If there's more than one person, so if you have like a group of people sitting in the room all looking at the screen, anyone that you want credit for needs to be known to Bakersfield ARC so they can make sure that everyone receives that credit. You need to send to Irene, and there is Irene's email address is right there, and she just put it on the screen as well. A brief statement that has at least three things that you learned from today's presentation. Can be bullet points, can be a paragraph. You don't have to write a 20-page novel. Just briefly, so that we know that you were on the presentation for the whole time and that you did actually find something of benefit from the presentation, and that in order to keep the books flowing, we do ask that you submit your request within 30 days. During the first year, we had some people who, like at the very end of the year, submitted stuff for that they had classes they had taken at the very beginning of the year, and it was sort of difficult to go back and look at all those records and what have you. So it works better for us, and then also you get the credit issued quicker if you do it with some immediacy. So we do encourage that. Okay, upcoming trainings that will be are on the landscape on the 30th of this month, and then again on September 19th. The CQL. CQL is a national organization. We've contracted with them to do trainings, and they're very professional. They offer many of these trainings online at $100 a person, and if you take them through the Bakersfield ARC program, they're free of charge. All of the links to register for the class are in my newsletter. Also, Irene has been sending out blasts every so often with updated training opportunities, and they're in there as well. But if you don't have those, you can contact Irene at okay. And you can contact Irene, and she can give you the information on any of the trainings. If you have not attended the trainings, or if you have, I would encourage you to attend this one especially. Community Building Connections is a very good opportunity to learn more about how to build communities. Just 1 second, please.
And then Tuesday coming back.
Yeah. All right. Sorry for that interruption. Anyways, one of the things that we talk about is building communities. Now, it's one thing that I go out and when I do assessments and when I talk to providers and they tell me, oh yeah, we're taking our clients out. So we shop, we go to movies, we go to the marketplace and for the Thursday night concerts or whatever. It's another thing to build communities where people are part of a community. So years ago, when I was involved with the Bakersfield Exchange Club here, I was the president of that organization. I addressed some of my membership and said, "Hey, how about getting an individual who is in the developmental services system into our organization?" And everybody agreed. So we actually worked with Bakersfield ARC, and they identified an individual who was interested. He became a member of our group, participated in all of our activities, became a very active member of our organization. And that, for him, that was a community. So it wasn't a matter of taking him out into the community, it was creating a community. And that's really the direction that we'd like to encourage you to look at with your, um, hang on, with the activities that you do for your clients. So this is a good class for that. There's also another one on embracing the dignity of risk. More and more, the field is really looking at clients making choices for their own lives. So as individuals are making choices for their own lives, some of those choices have some risk involved. If I say now that I want to be able to more independently use community transportation. So I want to use the Get Bus to get places, getting, waiting for the bus at the downtown bus terminal, being on the bus, getting off at the right place, talking with individuals on the bus. Other things, there are certain challenges that are all involved with that. And we want to make sure that people are doing it in a way that is as safe as possible and that meets their choices. And so there's the embracing the dignity of risk really talks about how you can go about honoring clients' choices and in ways that will try to minimize that risk, and also to how to go about documenting. So if something does occur, that it's well documented that this was something that was a client's choice and that you worked with them on making it happen, and that that they understood the potential for risk. Um, the Let's see, on July 9th, there's exploring communication. So for those of you who have individuals who have alternative communication styles, so not necessarily verbal communication, but maybe using sign, braille, communication devices, gestures, etc. How do you go about working with individuals whose primary way of communicating isn't necessarily oral language? And then the August 15th, we have the 3 E's, which really talk about things that you can do to explore, educate, and experience things with the individuals that you serve, so they have a better understanding of new opportunities to explore the community. And then on September 10th, we have person-centered thinking. Person-centered thinking is the model that all the services are supposed to be based on. And so if you've had your HCBS waiver evaluation of your facility, one of the things they're asking about is, are you doing person-centered planning? Once you get that IPP for that individual, are you implementing it in a way that's person-centered, et cetera? So that's a good class for introduction to person-centered. Kern Regional Center is going to be offering in the near future a 4-day class, full day classes that you can get certified or get a certification from them on person-centered planning and person-centered thinking. So if you're really interested in it, this is a good starter course. There's also a more extensive course that's being offered through Kern Regional Center. Okay. Before we get to today's agenda, which is what's listed here, I wanted to bring to your attention some other training that will be coming up in the very near future. This training is not through Bakersfield ARC, but I'm involved with another grant project that I'm working with an organization called Positive Purposes, and they're bringing back Dr. Tom Pomerantz, the gentleman from Indianapolis, who is a world-renowned speaker on issues related to developmental disabilities. And he will be at Kern Regional Center on June 10th and 11th to talk about bringing clients from being consumers to being producers. So it's about work and how do we go, because that's really the direction that we're going in. In 2012, the state of California, the legislature passed legislation that made California a work first state. So young adults who are leaving the public school system at 22, the preference is that they go into a vocational program, go into a work setting, go into competitive integrated employment, and not necessarily go into an adult day service for their the direction of where they're going. So employment is becoming more and more of an issue. The other issue, there are issues within employment regarding do people get minimum wage or above for their employment? And there is a strong movement nationally to move away from sub-minimum wages, so paying less than minimum wage. At Bakersfield ARC, they in December of 2022, they stopped paying any of their individuals served sub-minimum wage. So everybody who is in a work setting through Bakersfield ARC is now being paid minimum wage or above. In some cases, it's prevailing wage. So if there's a higher wage for that particular job, those individuals are being paid that. So that's really a push. So that's on June 10th and 11th. On June 12th, Dr. Pomerantz will be making two presentations that day, one from 9 to 1 and then one from 5 to 9. And those are really set up more for families of the individuals that we serve and the individuals themselves. So the people who are residents in your facility or going to your day program can come and hear more about what HCBS means for them, how it's changing the services. I've talked to many individuals who are receiving services who are saying, why is the day program that I'm involved with making these changes? Why are they shutting down the site? Why are they changing the way we do things? Why are we going out in the community more? I've talked to families who sometimes are not totally in favor of some of the changes or are questioning. No one's told them really a lot about why the system is sort of shifting in terms of how we deliver services. So good opportunity for consumers and for families to come. So if you're running a day program and you want to bring a group of 3-4 individuals for that day to the morning session 9 to 1, you're welcome to. If you have families or if you have staff that you'd like to have more understanding, they're welcome to that one. And there's also one from 5 to 9 in the evening at the regional center. Same presentation. And then on the 13th of June, Dr. Pomerantz will be addressing the presentation that he did last year. Last year, he did one on an overview of home and community-based waiver services. Some of you may have seen that presentation last year that Dr. Pomerantz did. He will be repeating that because some people said they missed it or that they really liked it, and there was so much, it was so packed, the presentation, that they would like to see that again. So that presentation will be on June 13th. And Irene just put up on the screen how you can go ahead and register for the Dr. Pomerantz trainings. The 10th and 11th will go from 9 to 4 basically, and lunch will be served free. So it's a free presentation, free lunch. What's the old joke? There's no such thing as a free lunch. Well, we're giving you a free lunch on the 12th, which is for 4 hours from 9 to 1, and then from 5 to 9. The snacks will be served, and then on the 13th, where we're doing the repeat of last year's home and community-based waiver overview. Lunch will also be served that day. And that is also 9 to 4. So I really encourage you to attend. Now we're going to move on to today's presentation. 4 things I'm going to talk about have to do with sort of the trends in the system right now and how they affect HCBS. So there are the 10 rules that we have gone over in these classes before. And 5 that plus accessibility for day services, and then the 10 for residential services. But there are other things that are going on in the system that sort of impact how these rule changes apply to us, and what is the direction of not only the way you provide services, but how the state provides services. And I'm going to talk about some of the changes that are being talked about and proposed, both in the immediate and in more long term. In the immediate, we have the state budget. For those of you who know, 2 years ago, California had $100 billion surplus, so that the amount of money that came into the state versus what we were spending, we had $100 billion more that was coming in than what we were spending on the state budget. And so the governor's office, the legislature, were very generous in creating new services. Some were one-time services, others were extended services. Well, as we moved into this last year or two, a couple of things happened. Some of the federal money that came into California for pandemic relief is now drying up. It was for a limited time, and so that money is going away. Some of the projections that were made in terms of that surplus were not entirely accurate, and the surplus wasn't quite the $100 million that they thought it was. And then also just that we've had a downturn. If you look at for example, the technology industry, there have been a lot of layoffs. There haven't been a lot of companies buying other companies. A lot of the things that sort of created the state's inward cash flow have slowed down or stopped. And so the state is now not bringing in as much money as they were projecting that they needed to make the state run. So they've done a number of things in the current fiscal year, and the fiscal year for the state is July 1 through June 30th. So in the current fiscal year, the state has made some changes. So some programs that hadn't gotten started yet, or hadn't spent all the money that they were going to spend for this year, got taken away or reduced. An interesting one is state employees get paid on the end of the month. So they were supposed to have been paid on June 30th. Instead of being paid on June 30th, they're going to be paid on July 1. Well, state payroll is $1.6 billion a month. So supposedly that saved the state $1.6 million. It really didn't. It just kicked the problem down the can down the road. But in anyways, so the state has taken out $17 billion of money out of the current year's budget to try to start the process of eliminating that deficit. In addition to that, the state, during the surplus, during the time when the state had more money than it needed, they put some money away in a rainy day fund. And now they're going to look at some of that rainy day fund to grab some of that money and use it to make up for part of the deficit. They're not going to take all of it. They're just going to take a portion of that rainy day fund. So it'd be like if you put away savings for an emergency, and all of a sudden your engine blew up and you needed that money, and it would be available to you. That's kind of what the state's doing. They're also looking at a number of different programs and looking at potential cuts. Now, this is where the developmental services budget the budget that runs regional centers that then come down to your facility comes into play. That it is both an increase and a decrease for this next year. The next year starts July 1 and goes through June 30th. So July 1 of 2024 to June 30th of 2025. So right now the legislature and the governor are finalizing that budget. It has to be submitted to the governor by June 15th. That's in the Constitution, state Constitution. And then he has to sign it by the 30th of June, and it then goes into effect on July 1. So that's all taking place behind the scenes right now. Now, on the one hand, the governor, his budget, which is $15.3 billion for developmental services, is up $1.6 billion, 12% increase over what the budget was for the developmental services system, including regional centers, including vendor monies, including all the funds that go into the system that we work in from last year to this year. There's two sources of that money. Part of that money comes from what is called the general fund, which is California state dollars, and part of that money comes from the federal government. And so if you look at this first slide, the governor's budget proposed includes a $15.3 billion overall. Now, I was in the system for a number of years, and I remember somebody saying to me, it took the first 20 years of the regional center system. So basically from like 1967 through about 1987 to reach $1 billion. 5 years later, it was at $2 billion. 2 years later, it was at $3 billion. So, and then now we're talking in the late 80s, early 90s. Well, lo and behold, in 2024 to 2025, the state's budget for developmental services is now up to $15.3 billion. So that's quite a large amount of money. About $10 billion of that comes from the California dollars, and the other and most of the other money comes from the federal government. Now, that money that comes from the federal government is what really makes us part of the home and community-based waiver, because the federal government said in order to receive that federal reimbursement, states had to follow these new rules. So California is sort of unique because California provides services to everyone. A number of other states only provide it to the people who are on the waiver program. So California's budget for the services that we have is both from the California General Fund, from California tax dollars, and also from federal tax dollars. And so what that increase of 12% is basically caseload growth. So new clients, new people coming into the regional center system, and also additional services. So those clients who are in the system receiving more services. So for example, social recreational services is really starting to pick up as a new vendored option. So as people are developing their person-centered planning meetings, so sitting down and writing their new plans for the following year, social recreation is now being utilized much greater than it had been in previous years. So that's an increase in spending on services. Here's an example of what the state's budget for services to persons with developmental disabilities looks like. So on the, if I can, I don't know if you can see that, but over here in 2014-15, it was a little bit under $6 billion. The darker color is what the state is putting in, and then the lighter color is the funds that are coming in primarily from the federal government. There are some other funds, but most of that's federal government dollars. So you can see that the federal government is contributing a fair amount, but that the state is picking up the bulk of the cost of developmental services. But those federal dollars come with that comes the home and community-based waiver requirements. So, and you can see how it's grown every year from about a little under $6 billion to where it is now over $15 billion, and that is within basically a 10-year cycle. So you can see how rapidly the system that we work in has increased. So that's sort of the good news in the system. The bad news, um, and where we're hearing most of the concern, and it's a major concern. I don't mean to minimize it. We want to do everything we can to try to get the governor to rethink this and to see about trying to get it, is there has been a rate study that was initiated by the legislature based on a number of different organizations and provider groups and government agencies looking at the system and saying, there's a lot of overlap. There's things aren't well defined. You go to this regional center and you get this rate. You go to this regional center, you get this rate. We need some more consistency in the system, and we need to make sure that providers are being paid fairly. So they brought in a third-party company that specialized in working with government agencies that did a lot of work with Medicaid, which is what they call Medi-Cal in the other 49 states, and also with Medicare. And this company did some extensive studies, book about this big, on the service delivery system. It was called Burns and Associate was the name of the company, and they came up with a 5-year plan for bringing the rates up to for group homes, for day programs, for other services, up to closer to where they needed to be. And that first started in about 2020, and it's gone on since then. A couple of problems with it. Prices have gone up since they first did the study, so the inflationary factor wasn't really built in as well as it should into it. So the rates that we're trying to get up to are rates from 4 or 5 years ago, not necessarily rates of what it costs to do things today. But one of the things that the legislature did was, when California was flush with money, is they accelerated that increase. So instead of being in 5 years, they said that the final payment would be done in July 1 of 2024. So they've done it in segments. And the original plan was to do the final payment in July of 2025. The legislature, when they thought had plenty of money, said, no, let's move it forward. Now that the state has found that they don't have plenty of money, they're actually in deficit. They're saying, the governor is saying, let's move it back. Both the House and the Senate in California have said, no, let's still move it forward. We've made this promise. We need to honor the promise. And most major organizations that are involved with developmental services are really pushing the governor's office to reconsider and to move this forward. One of the things that was in there is that in this final rate increase, be it on July 1 of 2024, which a lot of the advocates and legislator wants, or it be at 2025, which is where the governor's current position is. There was some of that money, the final 10% of that money. So you would get 90 cents on a dollar of the final rate, and the other 10 cents on a dollar you would have to earn through quality incentive payments. So the state would come up with certain standards of what would be considered quality service. And if you were meeting those quality service standards, then you would get the full dollar payment. So if your rate, let's say, was $100 a day, you would receive the $100. If you didn't meet that quality assurance standard for your particular type of service, then you would get 90 cents on a dollar, or in this case, you would get $90 for the day rather than the $100 a day for your service. Now, If the legislature and the advocates prevail and this goes into effect on July 1, so we do get the raise come July 1, then the state will have to come up with, and they've been working on it for some time, but they don't have finalized that quality incentive program that they want you to complete. But as of currently, that's not in place yet. If they hold it back for another year, so that last part of the increase that you as a provider will be receiving is not until July 1 of 2025, then the quality assurance, quality incentive payment will not go into effect until that date. So that 10% of your rate that will be based on a quality indicator doesn't start until the final part of the rate goes into effect. So that's kind of an update on what's going on in Sacramento and how that affects you as a provider. Now, where the main concern with all of this is that many of you, if you're have staff, if you're a small family home and you're basically have a family or friends working with you, it's not as big of an issue. But if you're a provider who has staffing, many of you have very major staffing issues, and the it's getting worse. Also, many vendors say that, hey, we can't take new individuals into our program because we just can't afford it. Where the rates are such that we're losing money on bringing new folks into the program. So we're not accepting new individuals. So although California does not have a waiting list for services, anybody who walks in the door can get services. But if you can't find a vendor who can provide you with the service, it is in a sense a waiting list because you're not getting the service that you need. So the whole issue of fair wages for people, rates that adequately compensate the vendor for their costs, because as you know, costs are going up; they're not going down, and so the cost of operating a home, the cost of operating a facility continue to go up. Your utilities, your light bill, any gas that you're buying, if you're home, food, insurance, all of that has continued to rise. And so getting the rates up to the full level that they're supposed to be, and then again making the statement that even if they get up to the rate that they're supposed to be, they're still not at the rate that they're supposed to be because inflation has somewhat eroded what that rate was a few years ago, which is when it was developed. So that's going to be decided in the next few weeks. Like I said, the legislature is talking about putting that back into the budget and having it go into effect July 1. The governor is saying, no, we need to hold it off until July of 2025. What happens is if the legislature and the governor disagree and the legislature puts it in to the budget and sends it to the governor, in California, the governor can do what's called blue pencil, which is that he can, once he gets the budget, he can take his blue pencil and circle an item and saying no. And then that item doesn't go into effect unless 2/3 of the legislature overrides the governor's blue pencil veto. So in all likelihood, on this one, the governor has a strong ability to have the final say in most of these situations. So like just yesterday, there was a rally up in Sacramento at the Capitol with people saying we need this rate increase now rather than waiting till next year to get that rate increase. And for those of you who are, following wages in California, a couple of months ago, a number of fast food establishments We're required to go to $20 an hour for minimum wage. Uh, there is legislation currently to um, get healthcare workers up to $25 an hour. So people who work in hospitals or other settings may have it high. Someone raising their hand? Go
Yes, yes. I have a question on that. As I am my mother as well. I am actually I wanted to share that I'm losing my personal provider for my child on the 31st of this year. He's literally going to McDonald's
Uh-huh.
because he gets paid $16 an hour. So
Yeah.
is there anything we can do to sign some kind of bill, or is that already in place and I just don't know about it?
Well, there is a number of organizations that are advocating in the legislature to bring about equity. And what you're sharing is not unique. I've read a couple of articles recently in like the LA Times, for example, about this very issue, about people who are having challenges, especially with in-home support services or other types of services to attract people with the wages, which are not even a living wage, unfortunately. Um, the challenge for our friends in the legislature, and this is, I'm not, this is sort of an answer, but it's not, so not what you're going to probably want to hear, um, is that we're not unique. We go up there and say, hey, listen, we're working with individuals with intellectual and developmental disabilities, and they're citizens like everybody else, and they deserve what all of us deserve, and they deserve to get uh, adequate treatment and care and respect and dignity. And we want you as a legislature to make a commitment to that. Well, as soon as we leave that legislator's room, the next group on his calendar that come knocking on the door and walk into his office are from the mental health system. And they're sitting there saying, hey, we serve this group of individuals, and our folks need dignity and respect and care. And then after they leave, a group comes in saying, hey, we're here from the childcare industry. And the people who are working with your young, vulnerable children are making, minimum wage, and it's very hard for them to make a living. We can't find staffing, and you need to make a commitment to children. So our friends in the California legislature are getting demands from a number of different areas for these budget augmentations. Now, in times when the budget is good, the legislature is more likely to just come back and say, okay, yeah, we can um, do some increases to help these folks. But then when budgets get bad, it's much harder. For healthcare workers, the governor finally agreed to at least $25 an hour for anybody working in a hospital. So for janitors, for the person who wheels you out when you go in for surgery and it's time to leave and they're going to take you out to your car, those folks are going to all be making $25 an hour. But the governor put a poison pill in that legislation that said if the budget gets kind of wonky, then we may delay it. And now they're looking at delaying it for uh, the rest of this year and next year. It's supposed to go into effect June 1st. So they're really looking right now at having to pull back. Schools get 40% of the state budget automatically. And there's some talk about, well, do we keep schools at the level they're at now? Or if we have to cut all these other services, do we cut them too? Because they should be at 40% of the budget. So it's a very, very challenging and complex issue. Now, on an individual basis, what I would do is there are organizations that are out there. The ARC, California ARC. Just go if you just text I mean, if you go on Google Cal ARC, you'll get their site, and they have a Monday morning newsletter. They put out a newsletter every Monday, which keeps you informed of issues related to what's going on in the field. There are a couple other lobby organizations. There's a lobby organization that represents the regional center system called the Association of Regional Center Agencies. There are United Cerebral Palsy. There's a number of groups that are all lobbying. There's also what I would suggest doing is getting online and looking up the Lanterman Coalition, Lanterman. Frank Lanterman was the person who wrote the laws related to regional centers, and so that's what they call the Lanterman Act. Well, there's a group of organizations that represent services to people with intellectual and developmental disabilities, and they've kind of pulled together into an organization called the Lanterman Act. And they put out a lot of good information and can share with you when stuff's coming up. If you want to talk to your local folks in the California legislature, your assembly person and your state senator, I would strongly encourage you to do that. As a parent, you have much more credibility than I do. So if I go up there, and although I'm very knowledgeable and I'm sharing with you all this stuff about the ins and outs of the political system, I'm kind of a political wonk. They view me as feeding at the trough. I make my living from doing stuff related to this. You, on the other hand, this is your family. This is the support you need to keep your son at home. If at some point, and hopefully it will never get to this, you were to say, hey, I just can't do this anymore, and I need to have my son in a residential option, show me what's out there, and you guys need to develop it for him. How much do you think that would cost the state? And it's going to cost them a whole lot more. And so they need to be supporting you and they need to hear that. And if they hear it from you, and especially if you bring your son with you to their office and show this is this is Robert, and this is what Robert likes doing, and this is and this is how he's part of our family, and so they see firsthand the impact of what that means to their community, to their constituents. That has the most power of anything. But like I said, unfortunately, this is not the year that we're going to be seeing a lot of increases in services. And, and so just have to continue. It's a long-term struggle. And I really encourage you to not get discouraged and to make your voice known and continue to make it known and to be a bit of a squeaky wheel at times. And that's the way you will see change on this. I know it's a long answer, but hopefully that's a little bit helpful.
Thank you.
Okay, moving on. Oh, you're welcome. Moving on, next slide. So here's an example. In 2023, the Little Hoover Commission, which is one of the, it's a state oversight organization that does a lot of investigating. They're doing a number of different reviews on state government. They looked at the regional center system, and they said a system in distress, caring for California's developmental disability. And they found there was a variation in services offered across regional centers, so that one regional center offered it this way, another offered it that way. And in the process that individuals must go through to apply for and obtain the services. So how do you get services? And one regional center gives this many hours, the other one gives this many hours. And so there is currently a piece of legislation, Senate Bill 1281, which would help in standardizing the process in self-determination. And self-determination might be another direction that you may want to look at, which is where you direct your own services. And so you would get a budget, and then you could buy your own services. And if you're at all interested in that, and if your son is a client of the Kern Regional Center, you can talk to your service coordinator, and they have regular meetings at Regional Center. You have to go through an orientation, and then there's a process that you go through. You've got to have a facilitator that assists you with it. You've got to have a fiscal intermediary, because if they give you the budget, state of California, it has to meet the federal requirements, and the federal requirement says that all the taxes and everything have to be paid. So you have to use a third party accounting type individual to do all of that. But that might be another option to look at to get services for your son, is to look at the self-determination program, and then just getting a personal budget, and then buying the services for your son yourself, rather than having to go through agencies and other ways of doing it. So I encourage you to look into that. Doesn't really work with IHSS, so if that's the way you're getting your services, because IHSS is a different agency. But for those dollars that Regional Center is giving you to support you at home, you could have more control over those. Okay, the Department of Health Services, which is the state agency that oversees developmental services. So there's at the state level, there's the big agency, the Department of Health Services. Department of Health Services runs all the services related to human services for the most part. So medical services in California, services to the elderly, services to the behavioral health, the state hospitals, all of that is all run through the Department of Health Services. The Department of Health Services has decided that they want to have what's called a master plan, a plan that looks into the future and looks at how we deliver services, and tries to look at some of the gaps and some of the challenges that we're going to see in the future, and to address them proactively rather than reactively. So for many years, we've sort of, as a system, as things change, we respond to that change after the change has occurred, rather than looking at it and saying, hey, this is coming down the pike. We need to make these changes now as it's occurring. No, most of the stuff has been done after the fact. And so the state is now looking at developing a master plan to streamline how they provide services. And this is really where it affects you as providers of services under the home and community-based waiver. Looking for services in different places. There is a lack of communication within these systems, and individual parents and service providers have the burden of connecting it all together. So if you're a family member, a provider of services, and you're trying to find the different services for that individual, it may be it's not all housed at the Kern Regional Center. Some of the services might be through Medi-Cal. Some of the services might be through the Department of Rehabilitation. Some of them might be through mental health, or which is now called behavioral health. There could be a number of different places that are all delivering services to that person that you're receiving. And what ends up happening is, oftentimes when you go out and start looking, one tells you to go this way, the other one tells you to go this way, one tells you no, the other one says, well, no, but they can't deny you that. You have to go back and appeal through them. And you end up, instead of going to like one place, and that place sort of coordinates all of your services, you get sent to a number of different providers. So if you've got children that you're working with, the schools are responsible for some of it, regional centers are responsible for it, maybe California Children's Services. For adults, again, there are a number of different agencies. So the idea is to streamline some of that, so that almost like one-stop shop. Go one place, get to, if they establish what the service needs are, and they sort of divvy it out. You take this, you take that, everything, and so there's a need for a much greater coordination of the services that are the individuals that you serve or your family members are receiving. Creating a dashboard where individuals can access records and look into paperwork completed by the service provider. So many of you have healthcare plans where you can go online and take a look at your healthcare stuff. I get my physician sends me things. Your file has been updated. I can go in. I can see what the last time I filled prescriptions, when I've had lab work, what the results of my lab work was, other things. In the regional center system, you don't get to see your own record, and or families don't get to see the record of their individual. And this would be a way to make it so that people who are authorized, so the individual themselves or people that the individual authorizes, could really look at uh, the services and how they're being done. Um, Services should be provided in a timely manner. Oftentimes, what you have is you request a service. It then has to go to an IPP meeting. The IPP meeting then takes place. The IPP document has to be completed. Then it has to go to a purchase of service committee. The committee then approves it. Then it has to be put on the computer. So it's not uncommon to, from the time you request the service to the time that it's implemented, for there to be fairly substantial delays. And that needs to be addressed over time to make sure that we get services to people timely. Individuals should not have to bear the burden of repeatedly providing that they're eligible for services. So you're eligible for services through regional center, and then you go to another agency and they'll say, well, you got to, establish your eligibility here, and then you got to go here. And again, this whole idea of one-stop shopping. If you're eligible for services, you're eligible for services, and you don't have to keep meeting eligibility criteria for across different settings. The service system needs to look at individuals holistically from birth to the end of life, so that all the systems like healthcare, uh, social and vocational services, mental health services, school, everybody are working together. Some states are starting to look now at a managed care system for their developmental disability services. Kind of like if for those of you who have an HMO, a health maintenance organization for your healthcare, you have a primary person who's then responsible for looking at what your needs are, and if you need to see specialists or other folks related to the service system, they then plug you into that. And this would be more than just healthcare. The couple states are looking at it. They're looking at having like one agency that would provide all of the services across the different settings for individuals. Okay, this slide's not the greatest. It's a little hard to read, but one of the things that they're really looking at are support brokers, someone who is outside of the realm of your service coordinator, who can really help you sort of navigate the system. How do I get what I need for my family member? How do I get as a provider, as a residential provider, as a daycare provider, vocational services provider, how do I navigate the system? I mean, there's Social Security because they get benefits, but then if they're working, how does that affect that? If they have healthcare issues that can maybe somehow impact their ability to live in the setting they want to in the community, if they have other related issues, if they have behavioral challenges that need either behavior management or maybe need mental health type counseling or medications, how do we go ahead and coordinate all of that? And maybe having somebody who sort of oversees all the different providers, third party person that kind of oversees the whole system, could really look at that. As we're moving forward with computers, how about what's going to happen with artificial intelligence and to provide information for families? Maybe you at some point could go to a website, plug in some of the information specific to that individual that you're serving or family member and what the needs are. And an algorithm could assist you with finding those services or help you navigate through that system. So in the future, uh, can we use the changes that are rapidly coming in technology to the benefit of the services that our people need? Um, One big area that we see, and then I'm going to cut it off after this because we're almost to the hour, and I want to make sure we have time for any questions that might come in. Is regional center staff should be more knowledgeable about how to navigate all these systems as well, not only regional center services. And that's, I think, a big problem is that in many cases, the regional center is looking at their mandate, which is in the law related to regional centers, that they're supposed to use other service systems before they use the regional center service system. So, regional center doesn't buy healthcare for the most part if the person has healthcare through uh, um, Medi-Cal, Medicare, private health insurance, et cetera, because that's another resource that can be used to buy that. So, regional center dollars are not supposed to be using for that. It's called generic resources, the same resources that anybody else in the community would use. But sometimes there's a misunderstanding about what those generic agencies can and can't do. So if you're a provider of service, so you're a daycare provider, and you have someone who's had some significant behavioral challenges in your program, and it's affecting their ability to continue to maintain their attendance and ability to be part of the community-based services that you provide because their behavior is getting in the way. It's causing challenges for the other residents, for your DSPs, for your staff, and they're not really functioning at their ability because of the challenges that they're experiencing. Well, you go to your regional center coordinator and they say, well, you should contact Kern County Behavioral Health and they can help you. Well, Kern County Behavioral Health has eligibility criteria. They have you have to have a certain types of diagnosis in order to get in the front door there. And if this individual has never been diagnosed with a mental health disorder or diagnosis, I should say that, and they walk in the front door, and there's a good chance that the mental health system might say, "Oh no, that's just a behavioral challenge. The person's having some significant behaviors. They've learned this behavior somehow. That their cognitive ability to fully understand the situation is such that they get frustrated very easily, and these are so. But that's not what we consider to be a mental health challenge. So here you have the regional centers making a referral where they didn't really know what the referral source could or could not provide. And there needs to be a better job of making sure that agencies sort of know what other agencies do so that when they're making their referral, because by law they're mandated to make referrals when it's appropriate, are not going to end up with you being in a runaround. So, all right. So it's 10:58, and I always like to, I could talk all day, but I like to open it up for any questions or any comments that anybody has. If you want to tell me, hey, great job, not so great, or have any questions or anything, I'm more than willing to stay on the line for a few minutes and take any questions. Just raise your hand if you have something that you'd like to, or unmute works too. Okay, hearing no questions. Next week, we have a couple of things on the agenda. On the 29th, I will be giving a webinar on boundaries, personal boundaries, that if you or your staff are working with individuals, how do you sort of, you're their staff, you're the people who work with them, and how do you sort of maintain uh, a good working relationship but you're not really their friend or someone. So what are decent boundaries? How do you sort of delineate what you do and don't do with the people you work with? And that'll be next week from 10 to 11:30. And then we have, yeah, go ahead.
Is it too late to register for that class?
Oh, no, no, just that one is just come on. Yeah, Irene can give you the web address for that, um, and then the following day on the 30th there is the CQL class that is also going to be, which is from 9 to 4. Mine's from 10 to 11:30, and you're welcome to all these classes are free. There are 2 grants right now. One that is being operated through the Bakersfield ARC, which is the one that did this one today, and we'll do the 2 next week. The one with Dr. Tom Pomerantz that's coming up in June is the other grant that's through an organization called Positive Purposes, and the 2 organizations are working together with, yeah, I already just put the information on the one for the 29th on the screen, are working together to enhance our community's understanding of HCBS and also its implementation. So we look forward to having you on subsequent webinars and hope that you have a good rest of the day. So with that, if there's no more further questions or concerns, I'm going to turn off the meeting for today. Thank you. Bye-bye.
Thank you.